Good morning, ladies and gentlemen. Thank you for the chance given to me to be a part of this conference. Firstly, I would like to introduce myself. My name is Ida Ayu Md Vera Susila Dewi. I'm from Bali Mandara Hospital, Indonesia. Now, I would like to present my case study about a carbapenem-resistant Acinetobacter baumannii outbreak in coronavirus disease 2019 isolation intensive care unit, infection prevention and control strategy. Carbapenem-resistant Acinetobacter baumannii, or CRAB, is one of the common causes of outbreak in the intensive care unit. We describe the CRAB outbreak that occurred at the COVID-19 isolation ICU, Bali Mandara Hospital, in the period July to August 2021. The COVID-19 isolation ICU consists of 7 beds with 2 single beds and 5 cohort beds. CRAB positive patients were included in this study, with isolates obtained from the patient's endotracheal tube sputum. During the outbreak, the infection prevention and control strategy was improved. Then observation and follow-up were carried out for the next 2 months. 9 of the 50 patients treated for COVID-19 during the outbreak period were positive for CRAB. The first 2 cases were discovered in July 2021 and became an outbreak due to the increasing number of COVID-19 patients requiring treatment in the ICU that didn't match the number and competence of nurses needed. And the outcome is of the 9 cases, 1 patient developed prolonged antibiotic resistance but eventually recovered. Its patient died of the underlying disease. The result of an in-depth investigation indicated that a positive CRAB case was found starting on the 6th day of patient care. All patients received antibiotic therapy since the first day of hospitalization. The organism originated from one source and was transmitted by health worker through indirect contact. Case management was carried out on an ongoing basis involving all parties in the hospital. The initial strategy implemented was the infection prevention and control measures to minimize the transmission. All patients who have entered the COVID-19 isolation ICU have been isolated and access was closed for new patients. Standard precaution and contact-based precaution are key control measures. Training and case discussion were carried out with nurses and physicians, including about the ineffective and inefficient use of PPE, which increases the risk of contact transmission. Environmental management has been implemented since September 2021 after all patients left the ICU by thoroughly cleaning the room and repairing the heating, ventilation, and air conditioner. At the end of the cleaning period, environmental specimens were examined. There was no CRAB in the environmental air. The second week of October, the ICU isolation room for COVID-19 began accepting new patients. Healthcare providers' compliance were closely monitored, and surveillance of patients was carried out continuously for next 2 months. 1 patient was found with CRAB in November 2021, but not related to the outbreak. The conclusion of this study is there was CRAB outbreak at the Bali Mandara Hospital for the period July to August 2021, and the comprehensive management of infection prevention and control was carried out to minimize further transmission. The outbreak had been handled. Routine infection prevention and control measures must be implemented to prevent the occurrence of similar outbreak. That's all of my presentation. Thank you and good morning.